This is Ethan Moore. I'm going to be discussing the different specimen collection techniques. First, we have the sputum collection. First, you should identify the patient with two proofs by their name and their date of birth, compared with the ID on their medical record. Then you would offer the patient to either clean or rinse their mouth with water, but tell them to be sure not to use toothpaste or mouthwash because it could make the test inaccurate. Perform hand hygiene and don clean gloves. Provide the specimen collection cup and instruct the patient not to touch the inside of the cup or the lid. Then tell the patient to take 3 to 4 slow, deep breaths, a full exhalation, a full inhalation, followed by a super hard cough. Then to expectorate or to spit directly into the container until you have 5 to 10 milliliters collected. Tell the patient to secure the lid on the container, wipe off the excess if there is any on the outside, and then offer the patient some tissues or anything like that, and then dispose of them properly. Offer the patient mouth care. After the specimen collection is taken, you can offer a mouth care to either brush their teeth, use mouthwash, rinse with water, and then you should dispose of your gloves, perform hand hygiene again, and attach the completed ID to the label and then the lab requisition. Confirm the ID with the patient in your presence, close the biohazard bag, and send to the lab as soon as possible. Next, we move on to the blood glucose test. You should identify yourself, ensure the patient's privacy, confirm their identity again with 2 proofs, name and date of birth, perform hand hygiene. Then you should don clean gloves, inspect the patient's fingertips, and clean with an antiseptic swab or cotton ball. Then prepare the glucose monitor, explain to the patient why you're doing it and what you need from them. Place their hand in a dependent position and start gently squeezing their fingertips so to increase blood flow to the puncture site, and then allow the finger that you swab to be completely dry. Place the injector firmly to the patient's fingertip and press the button to pierce the skin. Then you should place the lancet in the appropriate sharps container and then gently squeeze the patient's finger to form a drop of blood, and be sure to always wipe the first drop away. Place the test strip next to the patient's fingertip, close enough to apply enough blood for a reading. Then after 30 seconds, read the patient's blood glucose, note it in their medical chart, turn the glucose monitor off, remove the strip, and dispose of it in the proper receptacle. Then the nurse should remove their gloves, perform hand hygiene, check the fingertip to see if it's still bleeding, and if it is, tell the patient to continue to apply pressure, and then chart it in their medical chart. Now we have the throat culture. You should introduce yourself, ensure the patient's privacy, identify the patient with 2 proofs, their name and date of birth, perform hand hygiene, and some companies or healthcare facilities require the nurses to wear personal protective equipment, either a mask, a face shield, or both. So follow that. Then don clean gloves, remove the culture tube, remove the cap of the culture tube, then remove the sterile swabs, and be sure not to contaminate them. Tell the patient to slightly tilt their head back and say "ah." And if you can't properly see their pharynx or fully see their pharynx, you could use a tongue blade to depress their tongue. And when inserting the swab, be sure not to initiate the gag reflex or touch their teeth, tongue, cheeks, or lips. Swab quickly in a side-to-side fashion, and then remove the swab from the back of the mouth, place it in the culture tube, and secure the cap tightly, and then place in a biohazard bag. Send to the lab as soon as possible, and Always be sure to note if the patient's been on any antibiotics or antifungals, as it could interfere with the test. Then remove your gloves and perform hand hygiene. Next, we have the wound culture. Again, identify yourself, ensure the patient's privacy, confirm the patient's identity, 2 proofs, date of birth, and their name. Perform hand hygiene. Explain the order in which you're going to be doing things of the wound culture. And it also explain that the healthcare provider has ordered the test, and that you're going to be culturing their wound at the same time you do their dressing change. Prepare the culture tube and other supplies first, and be sure that they're kept sterile and in easier to reach positions. Be sure to label the tubes and perform hand hygiene and don clean gloves. Remove the dressing gently from the patient's wound and discard an appropriate receptacle. And then, again, don clean gloves. Perform hand hygiene, then don clean gloves. Place an absorbent pad under the patient's wound, so when you rinse it with saline, it's not dripping onto anything else, contaminating it. Rinse with normal saline to remove any skin, flora, or other contaminants. Remove the swab from the sterile tube, being sure to keep it sterile, and then gently rotate it inside of the patient's wound, being sure not to touch the edges of the wound so you can keep the skin flora out of the tube. If the wound is large, it may require several cultures and from different areas of the wound. So the first step is to swab in the culture tube. Put the swab in the culture tube. Then squeeze the bottom to activate the medium, and then push the swab further into the medium. Be sure that it's resting in there. Then firmly cap it and place it in the biohazard bag. Send to the lab as soon as possible, and again, note if the patient is on any antifungals or antibiotics. Then with the blood draw, again, gather your supplies, introduce yourself, ensure the patient's privacy, identify them with 2 proofs, name and date of birth. Then put the arm in a dependent position. Place a pad under the arm to prevent contamination again. Put on clean gloves and secure the tourniquet around the patient's arm. Then you would inspect the antecubital fossa, or the pit of your elbow. Then you would palpate it with your index finger to find the best vein for injection. Then you would cleanse the site with an antiseptic, swab or cotton ball, and be sure that it's completely dry. With your non-dominant hand, use your thumb to pull the skin taut and to stabilize the vein you're about to stick. Be sure the bevel of the needle is up and at a 15 to 30 degree angle, and slowly insert it into the holder, and steadily and gently push the collection tube in. The needle in the holder will pierce the collection tube, and it will begin to fill with blood. Then grasp the holder and remove the tube slowly. If several tests are required, then attach the other collection tubes, and once all are filled, remove the tourniquet. Place a cotton ball over the injection site without pressure and remove the needle quickly. Then engage the needle protector and dispose in the sharps container, the holder and the needle. Apply pressure to the site with the cotton ball after the needle is removed for 2 to 3 minutes or until bleeding is stopped, and then tape the cotton ball securely over the injection site. If the containers contain additives, then gently invert them several times to mix it, and then label appropriately. Place in a biohazard bag, and then remove your gloves and perform hand hygiene. Next, we have the 24-hour urine collection sample. First, you would explain the reason of the sample and how the patient can help by collecting their own sample. You would need to identify the patient with 2 proofs, date of birth and their name. Then you would explain that the sample must be free of feces and tissue paper. Place the container in the bathroom on ice or refrigerate it. Post signs to remind the staff and visitors and family of the time testing, and place them on, and the patient, and then place the signs on the door and the bathroom door. If the patient ever has to leave the unit, be sure that receiving personnel collect the urine and save it. And if possible, tell the patient to drink 2 to 4 cups of water before the collection begins. At time for the test to begin, perform hand hygiene, don clean gloves, and discard the first sample always. As the test begins, indicate the time on the lab requisition when you're putting it in the biohazard bag. The patient must begin with an empty bladder. You should measure the volume of each void if input and output are to be recorded, if that's required by the healthcare provider. Place all of the voided urine in a labeled bottle with appropriate additives, and unless otherwise instructed, refrigerate or ice in the patient's bathroom. Encourage the patient to drink 2 glasses of water before 1 hour before collection ends, and this is to get the patient to be able to void 15 minutes before the end of the timed period. Then you would perform hand hygiene and put on clean gloves to collect the final specimen. Be sure that everything is labeled correctly and that the appropriate ID is attached to the containers. Remove your gloves, perform hand hygiene, and tell the patient that the time period is up. Now we have the clean catch urine for male and female. First, you would provide fluids half an hour before the collection is to take place. Explain the procedure to the patient thoroughly, and then you would perform hand hygiene and put on clean gloves. Again, ensure the patient's privacy, and help the patient if they needed it to the toilet or onto a bedpan or to the urinal. If they're on a bedpan, be sure to elevate the head of the bed. Prep the sterile collection container and remove the lid from the sterile urine cup, and then place the lid with a sterile inside surface nearby, and telling the patient not to touch the inside. Next, we would instruct the patient to open the antiseptic towelette. If you're helping the patient, be sure to have gloves on. But if the patient was doing it themselves, they would open the antiseptic towelette, and starting with the female, she would spread her labia with her thumb and forefinger of her non-dominant hand. And then you would also instruct the patient to wipe with the towelette, cleaning top to bottom, first on the left, then the right, and then the center. While continuing to hold her labia apart, she would initiate her stream of urine. And after she started, she would move the specimen cup into the stream and collect 30 to 60 milliliters. The male is similar in that he will hold the penis in one hand, and he would clean the glans penis in a circular motion with an antiseptic towelette, and he would clean from center to the outside. And if the patient is uncircumcised, be sure that his foreskin is retracted before he begins. Be sure to tell him that. As he initiates the urine stream, after the urine stream is already initiated, pass the cup in front of the urine stream and collect, again, 30 to 60 milliliters. Then remove the cup before the flow stops and finish into the either the toilet, the bedpan, the urinal, and then you would instruct the patient that they could release their labia or their penis. Um, replace the cap. You would place the cap securely on the collection cup, and then you would be sure that the side is labeled, and be sure to never label the top of the cup. Always label it with the appropriate info and place in a biohazard bag. Remove and empty the bedpan or the urinal if that's applicable, and then label the requisition, remove your gloves, perform hand hygiene, and get to the lab within 15 to 30 minutes or refrigerate it immediately. Now we move on to the hemoccult test. You should again identify the patient with 2 proofs, explain the purpose, how the patient can help by collecting their own sample, and then perform hand hygiene. On the hemoccult test, you would open the flap of the slide and then using a wooden applicator, you would thinly smear stool in the first box of the Gaiac paper, I think is how you pronounce it. Then you would apply the second fecal specimen on the second box from a different part of the stool, and then you would close the slide and be sure that close the slide, turn it over, and then you would turn it to the reverse side, and then after waiting 3 to 5 minutes, you would open open the cardboard flap, and then put 2 drops of developing solution on each box. If it's blue, that means that it's positive and that there is fecal occult blood in the specimen. And then you would interpret it within 30 to 60 seconds, determine if it's positive or negative, and apply 1 drop to the quality control box. And interpret that within 10 seconds. Dispose of the test, and then you would dispose of the test slide properly in the proper receptacle. And then you would wrap the wooden applicator that you use in a paper towel and be sure that it's disposed of properly. Remove your gloves. You would discard them in the proper receptacle also with the wooden applicator and the paper towel. Then you perform hand hygiene and record what you found in their medical chart.